Hi guys, welcome to today's episode of the vlog series. Today we're going to talk to you about the MRCP SCE examinations in acute medicine. Okay, so the SCE certificates are not something that you can use for your GMC registration. So for that you'll need your MRCP 1, 2 and PACEs, as is the normal route. So you can sit SCE without having those, or you can sit them on top of it. The good news is if you've got your full MRCP and you add SCE to your CV, it's going to look really, really good to a prospective employer in the NHS. And it's also a great thing to be able to use as evidence if you're planning on becoming a consultant in acute medicine and progressing through perhaps the CSER route. Okay, so there are no official entry requirements for the SCE, so you could sit it at any given time. That said, a UK trainee would normally sit it towards the end of their specialty training, so perhaps ST5-6 level during their training in acute medicine. So probably advisable to sit it once you are at a pretty senior level if you're sitting it from overseas, perhaps even at consultant level in your home country. Okay, so the full range of topics that will be tested, over 200 questions, are as follows. I am going to read these out rather than remembering them. You've got cancer and palliative care and haematology, cardiovascular medicine, clinical pharmacology and poisoning, critical care medicine, diabetes and endocrine, gastroenterology, infectious diseases, elderly med, MSK systems, neurology and ophthalmology, renal medicine, respiratory medicine, and there are some other smaller ones as well which we're going to post up across the video. So it does test the full range of acute medicine, so it can be quite an in-depth test and you're going to have to revise lots and lots of different specialty areas. Okay, so the best ways to prepare for the SCE examinations, the RCP recommend that you use a combination of guidelines, textbooks and journals. The main textbooks to focus on are the Oxford textbooks. The guidelines to read from are the NICE guidelines, the SIGN and the SAM guidelines. And the journals that they recommend are the Acute Medicine Journal, the Clinical Medicine Journal and the RCP Edinburgh journals. Okay, so there are 137 test centres in the UK alone, so lots and lots of places that you can sit the exams in the UK. If you're overseas, the best thing we can recommend is if you go onto the website, type in your location, it'll give you a list of the nearest places. There's lots and lots of centres that you can sit in around the world. The cost of the exams, if you're in the UK, it's £665, and if you're overseas, it's £883 to sit the exam. Okay, so a couple of points to note. The exams are only sat once per year. It's usually in November, and the test results take 4 weeks from the date that you sit the examination to be released. Thank you so much for listening to today's episode of the vlog. If you've got any questions about acute medicine or the SCE certificates, then please do get in touch. As always, we'll put the contact details up at the end of the video.